And welcome to Internal Medicine Grand Rounds. I have a couple of announcements. Number one, I want to say welcome to Dinesh Kalra, our new Chief of Cardiology. We are looking forward to working with you and being on a journey with you together. Also, congratulations, Forrest Arnold, for accepting the acting Chief of Infectious Diseases, also started yesterday in his new role. Next week, just so to give you a heads up, one of our former residents who's now up at Cornell, New York Presbyterian, Dr. Justin Kingery, will come and be hosted by Internal Medicine. He's a course director of advanced hospital medicine, so we're looking forward to seeing what a former resident has learned since going elsewhere and what he'll teach us about hospital medicine. So the title of my talk today, Medice, Cura Ipsum, and my objectives were that I hope to highlight the importance of physicians as leaders and professional role models in healthcare, and examine the benefits of being an advocate and self-preservation that we embed in our healing arts. We will explore a little bit, if you allow me, the physician's psyche and successful adaptation to stress to account for our career-long wellness goals. I can't continue without going through a few COVID updates, because I know that that's top and foremost on your mind. We're still meeting, remotely. Sometimes that's good for people to meet remotely. For me personally, I don't thrive in a remote environment, so that's why I'm in the hospital all the time. But the COVID updates that I want to share with you today are that both vaccinations, as well as native infection, protects against the Delta variant to a degree, obviously not 100%, but those of us that are vaccinated or have had the infection are much less likely to have a poor outcome, including an ICU admission. Antibodies against COVID-19 last about 6 months. We've learned that based on some other institutions that monitor the antibodies of their healthcare workers. And so if your original vaccinations, like mine, were back in December, you may no longer have active antibodies and you may be due for a booster. I've talked with Drs. Batnagar and Forrest Arnold about us being smart about maybe when we give people boosters, and we're going to talk more about that later. Childhood infections do help foster herd immunity. If you really read about the history of COVID, it's interesting. There's been 7 COVID strains, and 4 of them were a long time ago and have become the, quote, common cold. The OC34 strain that emerged in 1889 from a cow vector is probably the most similar to COVID-19 in that elderly were most affected and they had the highest mortality. And also like that, there were cycles that lasted every 60 days where a new variant strain would come and then go away and then come and go away until almost the entire world was infected. So Jen Cook had Order Amongst Chaos 2021 and 2020, and I say now we have Order Amongst Chaos 2021, where we have to continue to follow infection control guidelines, remain adaptable to new innovation, maintain our healthy workforce, and the mantra should be get vaccinated or get sick from COVID. Continue to deliver healthcare, teach, perform research, and participate in academics. As Dr. Soe said, we're going to move forward no matter what. So it's still a scary disease, but we have learned how to cope with this scary disease. All right, I want you guys to be active participants. I know I only have 20 seconds to get your attention, so get out a piece of paper and pencil, because I'm going to ask you to do some work during this presentation. I do not want you to be on your cell phone or texting, or you won't get anything out of this. Be an active participant, and I won't take too much of your time. I will have to start, though, with the not so good facts and then end with some helpful strategies. So here's the not so good facts. healthcare burnout. I'm not sure I like the term burnout because I'm not sure that people actually burn all the way out. But we have to recognize that burnout is the opposite of engagement, and it is a serious global health problem. It affects all specialties. During COVID and pandemics, it affects especially emergency medicine, primary care, frontline, but also radiology, pathology, surgery, and subspecialties. Burnout during COVID has particularly hit ICU physicians, respiratory therapists, and especially nursing, bedside nurses. Unfortunately, it still exists today, even though we've talked about burnout for almost 2 decades in healthcare. Stigma, pride, blame have allowed the problem to fester and be ignored by many of the leaders in healthcare. From the last 5 years' data, the surveys to date show that the contributions to burnout primarily are these items, with number 1, too many bureaucratic tasks, charting, and paperwork that interfere with what doctors really like to do, which is spend time with their patients and teach. Feeling like a cog in a wheel, regulations. Lower down on the list is reimbursements. So we're more about what we want to do in the moment that upsets us if we can't do what we want to do in the moment. What about during COVID? Now, the most recent data, you're starting to see COVID enter into a contribution. So down at the bottom, stress or from social distancing and societal issues related to COVID, almost 20% of physicians say that's contributing to their feelings of burnout. Stress from treating these patients. But still at the top, too many bureaucratic tasks, now even a higher percentage of the reasons. If you remember any slides, remember this one. When I first saw it about 6 years ago, I was shocked. The green bar at the bottom is the growth of physicians in our country. And obviously the last time this was updated was 2015. I guarantee you it's continuing on the same trajectory, that the red bar are the managers. And so what we have is a serious imbalance between business and the practice of medicine. And all those managers, although a lot of them are really trying to help us do our jobs, we have to deal with them, and we're not necessarily dealing with each other in the most effective way. So burnout in the age of COVID, from an AMA Coping with COVID-19 for Care caregivers survey, 61% of physicians reported a fear of exposure to themselves or their family. 38% suffered situational anxiety, depression, or both. 43% were work overloaded, and 49% reported burnout. The number 1 at the top, the fear or exposure to self or family, led to people doing things like live in their basement, not communicate with their children or their spouse because they were the healthcare worker front line and they were really, really afraid of infecting their families, so they isolated at home just to work. Recent surveys since this particular survey also agree that 1 out of 2 healthcare workers suffered from burnout due to the pandemic. So sometimes this is what it feels like when we come to work. Back to the slide of too many administrators, it feels like us versus them a lot, and we know that's not a team. And what we know a team is a group of coordinated, united people to achieve a common goal. And us physicians, we're used to working in teams. We work in teams during school, on the wards. We're highly motivated to provide quality, and we do have strong opinions. We wouldn't have gotten where we are today if we didn't have strong opinions. And so with that, we get frustrated when our systems fail, when we're imposed with things that waste our time, and most of all, when we feel we have no input or no voice in the environment where we work. So that's what we collectively need to change. Now, what are some of the internal factors of physician burnout? Well, early on when we recognized this as a problem, now again, almost 2 decades, it's because healthcare changes and evolved and moved faster, maybe than our native resilience. We're very independent. We were always taught to compete against one another, and so oftentimes we don't accept help from others. We are initially very empathetic, and then when we get overwhelmed, we suffer a thing called compassion fatigue because maybe we weren't trained in self-care, we don't believe it's important, or we feel so empathetic towards our patients that we spend more time worrying about them than we do ourselves and our families. So the theoretical underpinnings of burnout include concerns on the left and buffers on the right. Again, the concerns: stress, cumulative grief, compassion fatigue, not understanding work-life balance. Education debt has become a very important factor, particularly for the younger physicians. Whereas buffers are all the fluffy things: well-being, resilience, self-compassion, connection, purpose, equanimity, gratitude, awe, joy. So that's the theoretical underpinnings of burnout. Now, let's take a trip down the physician psyche. We mentioned that we are generally people that already have a strong work ethic. We're professional, we're intelligent, we're highly competitive, we're generally confident, sometimes not as humble as we need to be, sometimes we come across arrogant. Generally, successful physicians are conscientious, they're role models in the community, and there's a perception that the good physician will have to live and promote a healthy lifestyle. If we are going to get our patients to take their medicines, exercise, diet, etc., listen to what we have to say, there's a perception that we better model that ourselves. And it was Socrates that first said, know thyself. If you know yourself and you know your weaknesses, you know your trigger points, you know the buttons to push, then you also know how many hours a day you can work and be effective and be empathetic. And if you think we have all the same personality, though, we don't. We have very varied personalities, which sometimes leads to our professional choice. Sometimes an emergency room physician is someone that likes chaos more than order, or likes a more rapid pace, whereas the more cognitive, deep thinker might want to see that patient again and know whether the decisions they made were actually the correct decisions. We can be very stubborn, and because we are all leaders, sometimes we're a room more full of alphas and less betas. And if you talk to most medical administrators and think about how they feel about us, I've seen this term over and over again. It's like herding cats. It's like herding cats, a bunch of independent people. So here's my question to you. Do you know yourself? Take out your paper and pencil right now, because you're going to write these things down, and I want you to keep your paper and pencil. I want you to write down, and I'm going to give you a minute, what do you appreciate most in your life or career? Second question, do you feel you get enough rest and relaxation? Third question, what makes you happy? Fourth, are you satisfied that you're heading towards your career goals? And fifth, if you have ideas of how your healthcare system can improve your work environment, jot a couple down. We'll talk about them in a little bit. Okay, first and foremost, and I've shown penguin pictures before. I think they're fascinating creatures. In this picture, who is the leader? Is it the brave, or is it the stupid one that's jumping over that cavern? Whereas the guy second in line is holding everybody else back, like, wait, Skippy's not going to make it. Wait. So a leader, though, is someone that we know promotes others, and a leader is also a great follower. And a leader values everybody in the team. So the purpose of my talk was to share with you a way out of the doom and gloom of what we call burnout, which I do not think is anything more than a daily mood that changes. Now, granted, you can have repetitive injuries over and over and then eventually be, quote, burned out. But I think, as Dr. Soe said at the beginning, if you listen to him, it's getting through all of the obstacles and coming out stronger on the other side. This is not a concept that is a new concept. One of the, in Prometheus Bound in 6th BC, I can't say his name, Aeschylus, who was a writer, a playwright, said the following: like an unskilled doctor fallen ill, you lose heart and cannot discover by which remedies to cure your own disease. Most of us, though, know from Luke 4.23, this was mentioned, Medice, Cura, Ipsum, and the literal meaning is, physician, heal thyself. But what does it really mean? It means practice what you preach. It means lead by example. It means be a critical thinker. You can be a follower, but not a passive follower. You have to be a critical thinker. We are the advocates for our patients. And more critics of this Medice, Cura, Ipsum say it really means avoid the hypocrisy of offering advice to fix others without first attending to your own shortcomings. I mean, we're the subject matter experts of medicine. Who but us would know how to handle the common cold, what to do if you get COVID, what to do if your blood pressure's up, whereas most lay people rely on us to be their advocate and tell them. So we know the answers first, and we need to share them, but we also need to take care of ourselves. So again, the optimally functioning physician must be well. I went to a burnout symposium. It was the second international conference on physician health. The dean let me go to that, and I was very grateful in 2016, and I love this cartoon. The mouse has figured out that he doesn't have to go through the rat doesn't have to go through the maze anymore. He can just walk on the edge and get to the beginning. And he said, why didn't I think of this earlier? The lecturer went on to say that the greatest asset in healthcare are the healers, and went on to say we're not interchangeable parts nor rats in a maze, but we're unique human beings that are each deeply devoted to our patients. It is our duty to find a better way, a new path, and to heal ourselves so we can succeed in healing others. Most of us remember one of the most famous basketball players, Michael Jordan, and this is what he said of resiliency. I've missed more than 9,000 shots, lost 300 games, 26 times I've been trusted to take the game-winning shot, and I missed. I've failed over and over in my life, and that's why I succeed. Now, I think physicians are probably some of the most resilient people in the world. Compared to other job burnout, we even have less. And I think that's because we take the winning shot, or we try for the winning shot on behalf of our patients. We make decisions rapidly. We live in a world of uncertainty. And I think that we need to pat ourselves on the back for being extremely resilient people. So I do not believe that lack of resiliency really contributes to a physician burnout. I think we're more like an elite athlete. I love this study. It's an old study now. It was published in the American Medical Association Journal. And it was about attitude and how that affects your well-being. And they randomized 1,000 adults into 3 arms. Now, the first arm over on the left, you were asked to rate your daily mood. This was a self-assessment. You know, was I happy today? Was I grumpy today? Was I sleepy today? You know, kind of reminds you of Snow White and the Three Dwarfs, happy, grumpy, bashful, you know, et cetera, et cetera. The second arm did the same thing, looked at their mood rating, and then anything that annoyed them on a daily basis. So I was happy today, but all my patients were late in endoscopy, or no one took their prep. Boy, that's annoying. And then the third group on the far right did a daily mood rating and then listed things that you're grateful for. I was happy today, and I found an early cancer and removed it, and now that patient's going to do very well. So they had these adults do this for a month, every day for a month. And then they looked at how they felt. And so they asked them at the end of that how they felt. And the group that counted their blessings more, which was the group far on the right, they were the happiest. They interestingly spent more time exercising, and they rated themselves as more energetic and alert. The group that did the worst was the group in the middle that said what was bad. And so the diaries did contribute to their emotional and physical well-being, but reminding yourself every day of the bad things in your day will bring you down. That's what the survey showed. You're happiest when you think of what's good and you count your blessings. So when we come to work, and it was a medical student who later became a gastroenterologist that was always happy, and I actually asked her one day when I wasn't so happy, why are you always so happy? And she simply said the following: I choose my mood. I thought that was just fantastic. And I have used that over and over again. You can be an actor. You can feel like my son did on the left when I tried to get him to take a photograph. And he would not smile, even though I paid for this professional person to take his picture. You can choose your mood. And basically it's putting on your game face when you come to work, bringing what is good. Don't spread the dread. From a psychological standpoint, understanding the biology of happiness, there is increased activity in the left prefrontal cortex by MRI. Remember that. There are important neurotransmitters, dopamine probably being more important than endorphins. And good news, we've learned that the brain is plastic, so it can rewire itself in response to experience. And that's why burnout isn't permanent. If you have positive experiences that replace negative experiences, you can actually rewire your brain and become a happier person over time. So this connection between psychology, physiology is not new. It has remote origins for cognitive behavior therapy by a Greek philosopher, Epictetus. He was a former slave under Nero, and Nero liked him and allowed him to read, and he ended up freeing Epictetus. And it was like my medical school friend that said, choose your mood. People wondered when he was a slave why he was always happy. And this is what he said, and this is what he philosophized. He said, individuals are responsible for their own actions. Good is to be found within ourselves. And he taught that external events that are beyond our control are things we shouldn't worry about. So health and illness involve more than the physical body, and cognitive behavior therapy techniques used a lot today by psychologists are really our drug-free mood mastery. Studies show it helps self-esteem, decreases depression, anxiety, and teaches self-control of the mind. So if you're not familiar exactly, I'm going to give you some examples. Drat, it's 4:30 and the ED just called me with a food impaction. We don't like that because they can be long procedures, but at least the nurses are still here. It's only 4:30 and so's anesthesia. That's a way to spin it. Second, they never have my medical records for my clinic patients. That makes you dread coming to clinic. But with Epic, now we can see the all-around records, and even if records didn't come with the patient for their appointment, we have a leg up, and we can control our attitude and mood that day and take care of the patient. And last example, my medical assistant is not well trained. Well, if you knew they only made $18 an hour, maybe you should put yourself in their shoes, give a lunch and learn, and help them learn what it is that you need so that when you're there in the clinic, you can collectively take the best care of your patients. So this is what I think of a physician's mind. We thrive on chaos. We love the fact that we can multitask. Our beepers are going off, our phone's going off, someone's tapping you on your shoulder, and that's a bit overrated, right? less can really be more. It's up to us to self-modulate what kinds of multitasking and numbers of tasks we can do in a day. It's up to us individually. Same thing with work-life balance. We talk about it, but I don't know the definition. Do you know the definition? Because I think it's an individual figuring out what their level of acceptance of numbers of hours a day of working or clicking, and it's up to us to figure that out individually. It's okay to say no without guilt, and it's okay to use the term work-life balance, but I challenge you to find somebody that can give you a discrete definition. There's no one size fits all. All right. I don't know about I'm not a laughologist, but I do know that I remember reading, if you laugh before 10 o'clock in the morning, don't know why it's 10 o'clock in the morning, but it may be that there's some physiologic changes. In fact, a lot of people believe in humor and laughter and smiling, sending out that smile, you'll get a smile back, and you can play that game going down the hallway. Look at somebody and smile and see if they smile back, and oftentimes they will, and you just made their day better. This is the laughless or wordless bond. And across the world, the first Sunday in May, if you wonder, is World Laughter Day. There are some areas of the country that get together and make faces and laugh. And if you wonder if you're attractive to the opposite sex, just laugh more at their jokes and you'll let them know that you are attracted to them. How about meditation? Something that I think John Klein tried to teach me how to do by savoring a raisin, but I'm not very good at meditating. One day maybe I'll slow down enough, but we do know that it is useful for reducing depression, lowering blood pressure, boosting the immune system, improving concentration, and can successfully be used to treat attention deficit. There are physiologic changes also with increasing theta waves, resting most of the brain, frontal and parietal, and marked increased blood flow to the left prefrontal cortex, which you learned earlier in this talk is the center of joy. To do it effectively, we're taught that we need to do 10 to 40 minutes a day. Find a quiet place, close your eyes, pick your favorite mantra, a spiritual word or phrase, say it over and over again is one method. Another method is breathing. For me, this is a photograph of a slot canyon that I took with my cell phone. So the best camera is the camera you have on you, and oftentimes it's your cell phone. Taking vacations is important, folks. Don't not take your vacations. Exploring other places will expand your mind, introduce you to new vistas, and not only that, but when you're feeling glum at home, you can pull out photographs of your prior trips and then remember all the rest of this trip to Arizona, for example. For many of us, what really makes us happy is community and networking. Can you imagine if these bees had had COVID, what they would do if we said, well, Buzzy, you got to go buzz off because we have to maintain social distancing. Well, I can tell you they all would have died because that is not normal. So it's not normal. Think of the poor school kids that are having to wear masks and be socially distanced from each other. It's affecting them, and it's affecting them psychologically. And we need to keep that in mind as we go forward together to try to fight through all of what we're dealing with today with COVID. Exercise, you know, is very good, not only for your muscles, but blood flow to your brain. It doesn't matter if you walk, run, bike, rollerblade, sit on a Ferris wheel, run at the beach. It's very important to get outside, get fresh air. And there's a sun here in the picture, and if you don't know, there's a whole field of science called photobiology. I learned a little bit about it when I was in college, and I used that as my excuse for studying for exams on the sun porch because you actually retain more if you study with the full light spectrum versus incandescent indoor lights. So get your exercise, and don't tell your patients to exercise if you don't do it yourself. That's hypocrisy. For me personally, pet therapy is also an outlet, probably my major outlet. I find it fascinating to explore the minds of other creatures and see if you can communicate with them in a way that they know they're your friend and you're not trying to harm them, but you're trying to help them. And for some of us, we just want to be left alone. We want a quiet place, a sunset, no noise. And while we know that Hippocrates is considered the father of medicine, William Osler is considered the father of modern medicine. And he said the following: the young doctor should look about early for an avocation, a pastime, that will take him away from patients, pills, and potions. No one is really happy or safe without one. That's William Osler. To me, that is representative of an early recognition that burnout can occur if you don't have a pastime away from your job. So, if you have not seen this movie, I highly recommend it. I think you'll find out if you're an empathetic individual or not. If you don't cry during this movie, maybe you need to be a little more empathetic. But it was a 2014 movie, I believe, Hector and the Search for Happiness. So Hector was a young psychiatrist whose life was kind of orderly. And in fact, it was getting boring. And he was concerned because most of his patients, he felt like it was his responsibility to make them happy and that they weren't happy. And so he decided, well, I'll be able to cure all of my patients if I just figure out how to make them happy. So he went on a journey. He sought chaos and went on a journey. It's a fantastic movie. It'll make you laugh. It'll make you cry. And it has a message at the end that Christopher Plummer said, and I want you to listen to this message.
How many of us, I wonder, can recall that childhood moment when we experience happiness as a state of being? That single moment of untarnished joy, that moment when everything in our world, inside and out, was all right. Everything was all right. And now we become a colony of adults and everything is all wrong. All the time. It's as if we were on a quest to get it back. And yet the more we focus on our own personal happiness, the more it eludes us. In fact, it's only when we are otherwise engaged, focused, absorbed, inspired, communicating, discovering, learning, dancing, for heaven's sake, that we experience happiness as a byproduct, a side effect. Oh no, we should concern ourselves not so much with the pursuit of happiness, but with the happiness of pursuit.
The happiness of pursuit. I love that. So, how to be happy in medicine, aggregating a lot of the opinions of the behavioral therapists. They say the following: appreciate what you have achieved and appreciate your colleagues. Pursue your purpose. Remind yourself why you chose medicine in the first place. Oftentimes that'll get you back to what really drives you and motivates you. Performing random acts of kindness will actually help yourself feel good about yourself. So the young mother in the grocery line with 5 items and you've got 50 in your cart, even if she doesn't accept your offer to go ahead of you, you can see her face lighten up that you just even recognized that she might be stressed. Give more than you take in life and you're sure to be happy. Focus on what personally makes you happiest, and like Socrates said, know yourself and be kind to yourself. We're our own worst enemies. We are very hypercritical of ourselves, and that's not good. A word of caution about staying in your lane. Control what you can. If it's not under your control, don't lose sleep over it. Maybe tuck away an idea and bring it up in the appropriate setting. But stay in your lane and you'll stay a little bit more comfortable. Each day, instead of thinking like doctors do, because we look at all the problems in the world and we think of all the problems and we want to fix everything, instead of that, recount at least 3 things that you're thankful for when you go to bed at night and have gratitude, and you'll probably get a better night's sleep. We didn't talk a lot about sleep. That would be another entire lecture, but sleep is very, very important for our retention and for our ability to perform our work the next day. So what were your answers? Pull out your little sheet. And I know we're not in a room where I can say, raise your hand if you said this or that. At the end, we can have some questions and answers, and you can tell me or tell each other what you appreciate most in life. I will focus on, do you feel you get enough R&R? I bet if I said how many people feel they get enough R&R, I doubt half of us would say we get enough rest and relaxation. So that's something we need to work on. What makes you happy, again, is going to be individual, but like Christopher Plummer said, it's probably moments. It's probably moments where you're not inside your own head, but you're outside and you're doing something wonderful in an environment. You're enjoying an interaction with a patient that transcends you or the patient, and you've taught a resident something, and you see the gleam and glow on their face. It's just those things that cumulatively add up that make a lot of physicians happy. And hopefully you're satisfied that you're heading towards your career goals. If not, you need to reboost, readjust, get a vacation, rethink. And if you have ideas of how the healthcare system can improve your work environment, I'm all ears. So here's this bubble cartoon about, how we can make burnout less. And I will tell you that we have done a lot at UofL over the last 5 years. Medical students are aware of the problem of burnout. Dean Gansel has been working on a collaborative. We've got a big group. We've worked on it, and then COVID hit, as everybody said, and then COVID hit. But leaders and administrators are still not quite on board, and we're working on getting them on board to have them listen to us to mitigate some of those aggravating factors in our job that cause our burnout. So Medice, Cura, Ipsum, moving forward. My hope for all of you is that you lead with enthusiasm or follow carefully, that you work with your healthcare system to strengthen the health of all providers and staff, and choose your mood. Bring your game face on. Engage your colleagues, and definitely take care of yourself first. No one else will. I told you, and I promised we'd end early, because I would hope that there will be some people that have some comments or questions.
Dr. Krueger, can I say a few things?
Gerby, please.
Yeah. You said wisely that happiness is an active process. It doesn't come to you. You have to go after it. But there's another issue which I faced in my life, that when you're in practice, money becomes your main issue, unfortunately. You didn't mention that, but I'm mentioning to you because I was part of that rat race. Your success and your happiness seems to come out how much money you make. And it's comparative. It's your peers. If somebody is making more money, you want to make that more money. I tell my children that their income is at the top, like 5% Americans. And if they're still running after money, they're hurting themselves.
So I'm glad that you brought that up. You see the pink bubble, choose physician incentives wisely. Nobody's tombstone ever says, in my retirement, I had $6 million, or I was happiest because I made X amount of money. I doubt anybody wrote down that what you appreciated most in your life or career was the amount of money that you made. You are exactly right. There's something inherently wrong with the way we set up competitions that you have to, quote, win. You have to win the race, not just participate in the race. And oftentimes we feel that we succeed if we've made money or achieved a title. And that's where you get into that. You're competing with the rest of the world and you're not thinking and knowing who you are as a person. That's why you have to ask yourself these questions. And I doubt anybody said what they appreciate most was the amount of money they made. And when you're young, you might think that's what you need to get in order to prove to yourself and the rest of the world that you have value. That is not what you will ever think, even halfway through the journey, and certainly not at the end of the journey. So money brings out the worst in us. Ask your financial advisor. They'll tell you that. That's why you need to have a will. That's why you need to articulate how you're going to divide your wealth that you've accumulated in your life so that your children don't fight over the remains. So thank you for bringing that up, because it's one of the negative underpinnings that we think we need to have, and it is not what makes us happy. Nobody ever says that's what made them happy.
Dr. Krueger, I sent a number of emails to my fellows. I told them exactly what you say. Here are the things that you need to do. You need health insurance. You need disability insurance. This is what it's going to cost you. And after that, you need this much money to live and save for 529 plans. Beyond that, you're asking for misery. It's sad to say, Dr. Krueger, I became two people, two persons. I was different at work and I was different at home. So when I was at work, I stopped thinking about myself and my family. And that's very dangerous for a physician or anybody. I tell everybody who listens to me, don't get into that stage where you become two people. And I think that's what unhappiness is. You become entirely different at different times of the day, at different times of the
Well, that's a conundrum because of the reality that is kind of like what Osler was saying, right? That the young physician needs to have something outside of potions and work. And you're right, you have to be a human being, and we are human beings. When you become the advocate for your patient, it does transcend into something a bit different. That's okay as long as you can balance it. So as long as there's work-life balance. Other comments or questions?
I was just going to say real quick, anyone, if you can unmute your mic and ask a question to Dr. Krueger, or if you want to type it in the chat area, I will see that and read it for her.
Okay, no pressure, but I will feel like a total failure if you don't have some comments or questions.
Or I think you covered all the bases.
Well, it's a tough topic, guys, and the first grand rounds is not supposed to be a grand rounds of a medicine topic per se, but of something to lead the team forward. And again, you have the skills that you need to be happy in your life, because it's a choice, just like your mood is a choice. You will have to deal with the frustrations of matrix organizations, too many administrators, or too many administrators that don't understand us and think we're just a bunch of cats. So those are the challenges. The overwhelming positives of a field in medicine is that's what we wanted to do, because we were interested in helping each other, and we were interested in the health and well-being of everyone around us, and hopefully also ourselves. So I want you to feel comfortable about the concept that burnout is a phenomenon, but not one that we can't come back from, one that we do come back from quite often. And just like that skilled athlete, we get some muscle injury, and then the next day we go out and we give another good shot. That's the exact same thing we do when we come to work every day in medicine. And I'm glad if I got you to leave for a moment your own world and come into a world of self-reflection. Maybe that's why you're quiet right now. And I hope that self-reflection does something good for you. And when you go to bed tonight, I want you to lay down and think about what you did good in the world today. That's what I want you to think about, and what you're grateful for. And bless you all, and thank you all. And we'll see you next week.
Hey, Dr. Krueger.
Yes.
We did have a couple of comments in the chat area. Somebody did comment saying they said thank you for the lecture, but it was necessary, and I apologize for the yapping dogs. Another comment from Chanel Benjamin said often something we do not take enough time to reflect on is medicine. And some more thanks for a great lecture. And also, Dr. Callan wants to know when you'll be getting your COVID booster.
Okay. Jeff, I think I'm going to ask Aruni to check my antibody titer, because I'm scientifically driven to see whether or not I have antibodies. And if I have antibodies, I'll probably go, nah, I don't need to get it. If I don't have antibodies, I'll probably go, do I want to get the infection? And so it's up in the air with me, but I think I want to use antibodies. And there was a study from Cleveland Clinic of 52,384 people, recently published. I'm having Forrest Arnold look at that right now, because it was a study where they looked at 52,384 healthcare workers that either got infected or got vaccinated. And they looked to see who got Delta and whether or not the groups differed in terms of their mortality and outcomes, and they were equivalent. So it tells me that it's good enough to get the shot as long as that antibody titer is robust. It may be that it's better to get the infection because you have more than just spike protein antibodies. But nonetheless, what they concluded from that study is if you've had COVID, you don't need to get the vaccination. And why is that important? Because some people that have gotten COVID that are young nurses, maybe pregnant or breastfeeding, don't want to lose their job. And maybe they've got a point. I interviewed a rheumatology candidate from Loyola, and I asked him, since he's a rheumatologist, immunologist, what they do at Loyola, and he said they've been looking at antibodies every couple of months. So looking at your antibody titer tells you what your immune system and response will be. And I think if we use that, I'm trying to engage with the creative minds of Dr. Batnagar and Dr. Klein and others, and look at antibodies as being a way to determine when and whom to get the boosters. They are available. Probably if it's been more than 6 months since you've had your initial vaccination, you might want to get your antibodies checked. If you go to give blood at the Red Cross, they will check your antibodies. So there's ways to get your antibodies checked if we can't do them here in the Department of Medicine. And that might let you make your individual decision as to when you get your booster.
Dr. Krueger,
Yes.
my understanding that antibiotic level does not necessarily mean loss of immunity. It's B cells and T cells. It's something new that antibiotic level means level of immunity.
So that's why they did that study from the Cleveland Clinic of the 52,000. They were looking to see whether or not, but you are correct. I mean, look at a child that has a fever. We are all oh, don't let the child have a fever. Let's give them Tylenol. Well, honestly, let them have the fever because their interleukin-2 levels are going up. And that is one of the reasons why children can get these high spiking fevers and bounce around the next day and be fine. They have a more robust response in the young person. And there are some viruses like the COVID-19 and the CO384 that primarily are lethal in the elderly because of the changes in the immune system functioning over time and over in your life. So, Jason, was there another?
I'm sorry. Yes, Dr. Dryden had a question. He's wondering, says, is our administration going to take this into account? This is a raging debate out there, and that many people are losing their jobs over this.
I opened my mouth at the board meeting, Tad, and I'm working with Jason Smith. I'm working with Jeff Bumpus. I'm working with Kelly McMasters and Tom Miller about this right now. So currently we're 2 weeks away from everyone has to have been vaccinated date or lose your job. And Department of Medicine has about 30 people left. And I'm hoping that we will look at each of them, maybe get them to get their antibodies checked. So, yeah, I think we need to be the advocate for each other, and we need to demand that science be followed when science and outcomes literature have shown a way, a truth, a recognized opinion. So if you know of people that are going to lose their job because they won't take the vaccination but have had COVID, I think I can help you with that, Tad.
I think that's it.
Like that the dog barks at the end, and now we'll play my favorite slide. Everybody stand up and dance. Important. This is your exercise for the day, and have a great day.
We can dance if we want to. We can leave your friends behind. Cause your friends don't dance, and if they don't dance, well, they're no friends of mine. Say, we can go where we want to. Things will they will never find. And we can act like we come from out of this world. We don't no one more behind. What's this? We can go when we want to. Night is young and so alive. Now we can just feel deep from our hearts to our feet and surprise them with a victory cry. Say, we can act if we want to. If we don't, nobody will. And you can act real rude and totally removed, and I can act like an imbecile. Say, we can dance, everything's out of control. We can dance, we're doing it from pole to pole. We can dance, everybody look at your hands. We can dance, everybody's taking the chance. Safe to dance, oh, it's safe to dance.
Thank you, Dr. Krueger. That was outstanding. So. All right, everybody. That's a wrap for this week. And again, next week is same time, 8 a.m. next Thursday, hosted by Internal Medicine. Again, our speaker will be Dr. Justin Kingery from Weill Cornell and New York Presbyterian. And he also, as mentioned, a former resident here at UofL. So looking forward to that. And we thank everybody for joining us. And we're off and running back to Grand Rounds. I'm looking forward to it. We'll see everybody later.